Okay, so welcome everyone, and thank you so much for being here today. We have a great panel discussion for you. And as always, this panel will be available on HHP's events page, which I will make sure to link in the chat. But officially welcome to Building Your Healthcare Team, a live panel discussion with an emphasis on Alzheimer's and dementia. And this panel is brought to you by the Human Health Project. I'm Taryn May, HHP's online events coordinator, and I am your Zoom host for today. You are welcome to message me privately through the chat if you have any questions or if you run into any issues. I'll be here for you in a support capacity. And to keep things simple, I may disable people's microphone or video if anyone is unknowingly distracting. Please feel free to add your questions to the chat if you have any questions for the panelists, and I will be collecting those as well. We will also have a Q&A session at the end of this pre-planned discussion. So now I would like to introduce our amazing panel members, and thank you so much for being here today. We have Jan and Randy Haberer, who have been personally impacted by Alzheimer's and related conditions, and they're both very active members of the Alzheimer's Impact Movement and the Greater Dallas and Northeast Texas chapter of the Alzheimer's Association. We also have with us today Mandy Wilson, who is a registered mental health nurse and the head of Wellbeing Services for AH Northern Ireland. And last but not least, Tina Thomas is a health and human services advocate, and she is currently serving as the Associate Director of Community Engagement for the Alzheimer's Association. And then moderating the panel today is Dr. Phil Harrington, the CEO of HHP. So Phil, over to you.
That's great. Thank you so much, Taryn. Thank you so much to our panelists for coming on today and sharing your experience with the people on the Zoom call today, but also as well people who will be watching the recording over time. That will be, as Taryn said, on our website. Just to give you a little intro and to people tuning in today and in the future, our mission in Human Health Project is the promotion of peer-to-peer holistic health with 3 pillars: information, education, and support. Our information side is represented through real-world data, where we collect information, data on causes, triggers, symptoms, treatments, treatment outcomes, and side effects, which we have done so far. We've piloted so far with migraine and lupus. We're now working to be able to have that for unlimited conditions in the future going forwards. Education is our second pillar, which is served to our Learning Academy. We have produced patient advocacy training courses and patient education courses, which are available on our website to partners, but also as well, we recently released our first online available to the public course called Patient-Driven Data and Diagnosis. And we have a whole curriculum of courses coming up behind that. Thirdly, our third pillar is our support pillar, which is represented through this program and also our patient advocacy program, which we are running at the moment in Northern Ireland. And then our plan is to grow that into other areas in the US and so on in the future. So thanks so much again to our panelists for coming on and for everybody on the Zoom today. I'd like to begin by asking Jan and Randy to share their experience and also their insights on building your healthcare team. So over to you, Jan and Randy. Thank you so much.
All right. Thank you, Phil. Hi, my name is Randy Haber, and this is my beautiful wife, Jan. And we're coming to you from Carrollton, Texas, which is a little north of Dallas. And since we consider ourselves a team, we're going to split this into 2 sections. And Jan's going to open up by telling a little bit about our story. And then I'll follow up by talking a little bit about building your healthcare team. So, Jan.
Okay. So I'm going to give you a little background of where we came from with this Alzheimer's. My mom was diagnosed with Alzheimer's in 1999, and we had just recently relocated to Tucson from the Dallas area. And so that next year we made several trips back to Dallas to help my dad deal with this new disease that no one knew anything about. Alzheimer's was such just something that no one knew about at that time. And so I made a call to the Alzheimer's Association just to get some sort of background, just to get some information so we would know how to proceed. My mom eventually transitioned into a home from her residence, and she lived there very successfully for the next couple of years until she eventually passed away. And at that time, I thought, oh my God, I hope no other family ever has to deal with this disease. It is just so heart-wrenching for the family, as well as for the person itself. I'm going to fast forward a little bit and give you a little history about me. I graduated from SMU, Southern Methodist University, with a Bachelor of Science degree in mechanical engineering. And from there, I went to work for Texas Instruments, a defense contractor here in the Dallas area. And Randy and I met there at work, and eventually the TI Defense Division was sold to Raytheon, and that's when we were relocated out to Tucson. And so we watched what this disease was doing to my mom 1,000 miles away. And we knew at the time that we needed to get back to help her and to help my dad, more importantly, with the caregiving responsibilities that come with an Alzheimer's diagnosis. And it's funny because when we came back, Randy went to work. He was able to transfer back to Raytheon, and I transferred back to Texas Instruments, but in their semiconductor division. And for the next 13 years, my career flourished. I was quality manager, and eventually ended with a strategic program manager, which was the job that I had wanted for a very, very long time. And it was at that time that I started making lots of mistakes at work. It was so unheard of with me. I had always been a very solid performer, but I couldn't perform the simple tasks that I had always done. I couldn't remember common industry names, terms. People were unfamiliar. It was very scary and very frightening. And, it was kind of crazy. My boss was very tolerant at the time. And, he dealt with me in this situation, but eventually this making mistakes became my new norm and not the exception to the rule. So I knew that I needed to pursue medical help and to find out what was causing this, because this was just, like I said, this was just unheard of and out of the norm. So throughout the course of probably about 6 months, I think, we went and visited several doctors and trying to rule out everything that, trying to just determine what was going on. Anyway, I ended up with a neurologist. And it was at that time that he performed a battery of tests and came with the diagnosis of mild cognitive impairment. And then he prescribed drugs, Alzheimer's drugs for me. But mild cognitive impairment, or MCI, is a decline in cognitive ability that affects memory, judgment, thinking, things that are out of the ordinary age-related things that happen, I guess. It just happens earlier in life. And so, at least with me. So I just, with this diagnosis, I kept trying to work, and I wanted to keep this diagnosis under the radar. I did not want to let my people at work, know that I had something going on, because I didn't know how they were going to handle it and whether or not it'd be a stigma, to them or whatever. So continued working, and I once again reached out to the Alzheimer's Association because they're my resource for learning about now younger onset Alzheimer's. I was only 53 at that time. And so I needed to find out as much as I could. And so it was probably about 3 or 4 months later, the Alzheimer's Association gave me a call and said, hey, we have a group that's forming called the Early Stage Advisory Group. And that's a group that Randy and I just, we jumped on. We wanted to be with people who were going down the same journey as we were, because it consisted of someone with a diagnosis as well as their care partner. So we banded together and we helped the Dallas Alzheimer's Association deal with strategic projects that they had, and things that the company or that they wanted to help tackle. And so Randy and I got a lot out of that. One of the biggest projects that I'm most proud of was a toolkit that we helped put together called Why Employers Should Care. I mean, this was a toolkit that said, hey, employers, people that are dealing with Alzheimer's, here's some of the things that you need to be conscious of and help them with, as well as people in the workforce. This is what you need to, these are some of the things that you need to deal with and be cognizant and helpful with them. So being part of the early stage advisory group was truly a blessing for us, and proved to be kind of like the launching pad for our involvement in the Alzheimer's Association. From there, we became very involved in probably one of the walks to end Alzheimer's, and that one was the one that we were part of for several years, for a couple of years. And then our team got so large, we said, oh, wow, we need to form our own team. So we formed Jandy's Clan. And this has now become a very, very top team in the Dallas area. We just finished our walk last week, and we're sitting at number 2 in the Dallas Metroplex, raising the most funds and having the most people walk with us. So, it's kind of truly a blessing in that regard. I'm going to jump back to my work. I kind of forgot about that, but I kept working for a couple of years, and then it just got to be too tedious. I could not keep up with my work, and I eventually had to go on disability. And so from there, Randy and I decided to treat my diagnosis as a life sentence and not a death sentence, meaning that we're going to do everything that we possibly can to help others who are dealing with this and on this journey. So I'll pass it over to Randy and let him talk about our care team.
All right. Well, hopefully that gives you an idea of why Jan and I feel driven to be advocates in the fight against Alzheimer's disease. Excuse me. The one point I try to get across to people when I talk about caregiving is that no one should do this journey alone. Jan has an amazing support system with all the friends and colleagues she has built relationships with over the years. Unfortunately, we meet many people in our support group and our circle of friends that don't have a large support system or the financial means to afford professional care. There's also still a stigma with this disease that make people uncomfortable sharing their loved ones' issues. With any cognitive impairment, the person affected needs an advocate, and that advocate may be you. One of the most obvious people you need in your corner are the doctors and medical professionals. You need a neurologist who takes the time to understand your issues and your needs. It is critical to make sure that all your doctors are sharing data about your medical history and current conditions. Something as simple as keeping all your doctors up to date on your prescriptions can be critical to those drugs working properly. Many drugs interact with each other and can either lessen or increase the desired effect, which can be very dangerous to the patient. An example of collaboration between doctors that we have experienced is the consultations that with anesthesiologists when Jan had major back and ankle surgery. While there isn't a lot of data on the effects of anesthesia on cognitive function, we are suspect that the general anesthesia Jan received during her first back surgery kickstarted her cognitive issues. We now consult with Jan's neurologist and any anesthesiologist prior to surgery to ensure we minimize the effects of the obvious need for some anesthesia during surgery. The other part of your healthcare team may not have any medical degrees, but they can be just as important. Back to my comment about not doing this journey alone. Family and friends are typically the strongest support system for most people. Unfortunately, some families are very small, far away, or estranged for various reasons. Another serious issue is whether they agree with the diagnosis and the care plan. This makes support groups even more important. It allows people to share their stories and tell others what they are struggling with and what they have found helpful. This sharing not only helps caregivers with tips on how to deal with their unique situation, but also lets them know that they are not the only one dealing with issues similar to their struggles. Another part of your support system should also be the many resources out there. The one we have used the most is the Alzheimer's Association. It has a website and a helpline that is available 24 hours a day, 7 days a week. They not only have resources, but they can also be a sympathetic listener. We've talked to people who said they called the helpline in the middle of the night just because they were at wit's end and simply needed someone to talk to that could relate to what they were going through. Another great resource available through the Alzheimer's Association and other sources are clinical trials. Depending on the trial, you may get to try a new drug, or better yet, help the next generation by being part of the data collection and research that will be required to someday find a cure to this horrible disease. Another benefit that Jen has actually experienced is that you can have tests like PET scans and MRIs that otherwise would be cost prohibitive. In many cases, in Jen's case also, the data from these tests can be shared with participants. It's not always the case, but it is, and we've gotten some valuable information from that. And last but not least, a key part of our team has been our faith in God. It is comforting to know that we are not in control and that God has a plan for all of us. We believe that Jan's slow progression of her MCI is a sign that we need to continue our advocacy and help as many people as we can in what is arguably one of the toughest journeys many of us will ever go through. I hope our story and some of our suggestions have been helpful to you and your loved one. Thank you and God bless.
That's great. Thank you so much, Jan and Randy. That was really inspiring and informative. Thank you so much. So now I'm going to hand over to Mandy, who is in Northern Ireland. So we'd love to hear from you, Mandy, your experience and your suggestions on building a healthcare team. And you're on mute at the moment, Mandy.
Sorry, that's me now. Apologies. So hello, everybody. Thank you all for going to listen to me this evening. And I hope that you, or this evening with me, I know it's afternoon with you. And I hope you can understand my accent. And I'll try and speak a bit more slowly than normal, as we tend to speak fairly quickly in Northern Ireland. So my name is Mandy Wilson. I'm 53 and I'm from County Antrim in Northern Ireland. And my background, I started nursing in the late 1980s, general nursing. And I quickly discovered that I had a special interest in supporting individuals who were living with dementia, or at that stage, I thought living with a confused state and confusion and memory loss and all that type of thing. And that quickly inspired me to carry out further study, and I then trained to become a registered mental health nurse. I went on then to do a degree in health studies, a Bachelor of Science, and then a Master's in Dementia Studies, and then also a leadership course in public and people involvement, which I'll elaborate on later. So then I worked as a staff nurse in hospital wards for many years, and then in the community as a community psychiatric nurse, and in the private sector as a nurse manager of a nursing home, supporting people who were living with Alzheimer's disease. And throughout all of this, I just continuously was trying to improve care and supports available and ensure that staff teams were educated and informed of the latest research so that we could provide the best support possible for each individual in our care. 12 years ago then, I decided that my pathway would be to work in the voluntary and community sector, and I began working with AGNI, which is the leading charity for older people in Northern Ireland, as head of wellbeing services. And at that stage, we had 2 services supporting people living with dementia, and we've now been able to, spread those out over all the trusts in Northern Ireland, and I now have a staff team of 13. And the reason for moving over to the voluntary and community sector was I felt that support could be more innovative and more person-centred. And it would allow us to roll out, after the appropriate research was completed, those innovations to ensure that we were truly delivering holistic person-centred support. And it allowed integrated working with the health service as well. And we ensured that clients and carers were involved in every step of the way. And one of my very early learning and experiences, and one that I find core to all of my practice, is that a person living with dementia or Alzheimer's disease, particularly I'm referring to the later stages, that while they always didn't remember my name, they always remembered how I made them feel. And they also remembered experiences. And given an example of that, Age Northern Ireland have a day centre where my office is based, and it's in quite a rural place. And families often would have said that their loved ones couldn't remember everything they'd done throughout the day when they were there, but they certainly remembered having a good day, and that reflected on their mood. There are currently 20,000 people in Northern Ireland living with dementia. And it was very important for me to look about building a healthcare team that really could provide the support that people want and people need. And I guide my team by leading by example. And I really feel that if everyone adopts the values, that they treat every single person they support with the care and the compassion and empathy that they would want for their own loved ones, then a good baseline is set. And then I try to provide measurable objectives as a resource to help guide the staff in excellent service delivery, and continuously educate the team in critical skills such as communication and relationship building. And it's essential to build each member of staff who works alongside me as well with their strengths, ensuring as well that the caregiver objectives are met. And teamwork is essential, improves morale and improves organisational productivity. And this is particularly when new members come on board. So when we expanded the services out and new members were coming on board, it was really, really important in the formation of them as well. That over time, with strong leadership, that team members learn to accept each other and the policies govern the workplace, but in turn, a really good rapport is developed where trust is high, and then the focus is on providing care and support, optimal care. And I'm very, very fortunate. I really have a fantastic team who support each other, who really care about the clients, who really care about our carers, who really just want to go the extra mile. And it really is a pleasure to work with them all. And it's really important for me as a leader, to exhibit exceptional ethics and morality, setting the bar, for workplace conduct and attitude, and fairness is core. And I'm a great advocate of PPI, and that is known, that's the term personal and public involvement. And it's a concept and practice of involving everyone, whenever we're planning services and commissioning services in the delivery and evaluation. And it's integral to service innovation and in turn delivery, ensuring that all stakeholders effectively contribute to individual client outcomes and maximising every potential resource we possibly can to deliver really good client services. And in terms of PPI, I found it to be the most active, effective involvement of those who use our services, our carers, the public, essentially get their ideas, our ideas, bring all of our plans together, individual experiences, our experiences, why services are needed and what people really want from these services, and how to make best use of resources and how to listen to these views and therefore improve the quality and safety of all services. Also within Northern Ireland, the dementia-friendly communities is really instrumental. And I've used Belfast as an example because Belfast is the capital city of Northern Ireland and split into 4 areas: north, south, east and west. So I'm just going to use one area, which is East Belfast. And East Belfast, in a small area, has already set up 35 information hubs. They've trained 760 dementia friends who are volunteers and run courses, countless courses. They're interactive dementia awareness courses and training events. And in practical terms, we talk about small changes. In the cafes in East Belfast, there's a sticker on the door, dementia friends, and people know when they're living with dementia, if they go there, that the staff understand and they really feel at ease and not worrying about ordering things, and they know people have time and the patience. And you know, give people extra time when they're at the till, when they're trying to manage their money, and just supporting people to be as independent and live their life as fully and as independently as they possibly can. You know, it's really important to me that we help each person living with dementia to feel empowered and valued and safe and supported, you know, to really live their lives as they want to live them. And as I've mentioned, you know, when I was chatting about PPI, very often in the past, you found that people commission services and ideas without actually asking the person who was living with the condition and their care what they want and how they want it delivered. So making an assumption is not a good thing. You know, it's really important that they have their views and those views are heard and are really meaningful. So we found also, going back in the years in Northern Ireland, there was a lot of misunderstanding around dementia and Alzheimer's disease, you know, and it's much more than memory loss, and the public really do have a moral responsibility to learn more about dementia. And it's fantastic that so many people have come on board throughout all of the trust areas to see how they can help people in their own communities and neighbourhoods, you know, and respect the fact that everybody has the right to lead their life just as they want to lead it and continue to do just what they want to do. So really important. And then of course our peer-to-peer, you know, peer-to-peer for care. So care support within AGNI is giving carers, you know, the opportunity to gain support from their peers and sort of swap their contact details and form friendships. And we've groups, prior to COVID, they were face-to-face groups. During the pandemic now, they are normally virtual. And the carers will tell us what they want. So we've done things like relaxation and keep fit. We actually employed a personal trainer to come on, and that went down very well. Although he wore a pair of shorts and they said they wanted him dressed properly the next time in his tracksuit. So we got that sorted out. And then within AGNI, we have a program called Good Vibrations, and we were very fortunate to get funding for that. And that meant that every person who wanted to join in got a Garmin, which is a device. I don't know if you've heard of that or not, the Garmin device, and able to measure their activity and their sleep and lots of different things. And it was a really good online community support for people as well. And then we also looked at dementia awareness and sleep, and we signpost out to the Alzheimer's Society in Northern Ireland too, because they do a really good training for carers, which covers, you know, topics such as understanding of dementia and providing supporting care and legal and financial matters, and then sort of coping day by day. So delivery of service to people who were living with dementia during the pandemic. And Jan, I'm glad we were talking about MCI there, because I noticed in dementia services, we had a gap in Northern Ireland throughout for supporting people with MCI. They maybe had been told they had a mild cognitive impairment, and any problems, just see your GP. So I've seen a gap there. So we are piloting a service now, and it's really, really going very well. Virtually, it really was planned to be face-to-face, but virtually we are, you know, we've got lots of things set up. We have virtual groups which you can join by telephone if people are not happy using devices or unable to use a device or don't have one. We have a check-in and chat service, which means anybody who's feeling a bit isolated or lonely gets a telephone call from a volunteer every week. We have bespoke telephone and virtual support for anybody who's more complex needs. And the door is open all the time. The staff are just excellent. So no problem. Is it too small or too big? So, and normally we would do those types of things, you know, support through a guided conversation, and the client would decide, you know, what support, how they want their support to be led, and very often set goals in relation to this. And that could be something as simple as somebody, particularly prior to COVID, you know, getting out for a cup of coffee or walking their dog on the beach, to somebody who wanted a horse ride at 70, and they did get there. We did do that prior to COVID. So that's a big start for that person. I can't believe it, to be so brave and wanting to learn how to horse ride all your life. So now virtually, they're still very happy to think about what they're going to do after the pandemic leaves and get back to that again. So it's just finding new and innovative ways during the global pandemic to make sure that we deliver, you know, all the staff deliver the proper care, it's holistic and that's meaningful, and it can be adapted to suit everybody's needs. So really, that is me. Have I come to my time yet, Phil? I didn't even, yeah.
You're just about at 10 minutes.
So that's perfect then. So that's really my story and how the workforce has been built, who work with me, and things will change again. You know, everything changes, and post-pandemic, we'll be looking at different ways of working too. And prior to this, I mean, my staff now as well, building the task force really has been brilliant. The COVID bit has been good for all this IT type of things, because prior to that, I couldn't, including myself, honestly, I knew how to email. Zoom was zooming off in an airplane somewhere. So we've all learned new skills, and we've got a bit of funding as well, and we've been able to provide quite a few clients and carers with devices, which has been really good because we've been able to teach them to maybe order their prescriptions or order groceries or communicate with families. You know, so it's really reduced isolation and really built confidence. And it's amazing how many people who didn't have a device who can now use it and are coming under groups, and really, it's really making a difference. So thank you all very much.
That's great. Thank you so much, Mandy. I really enjoyed listening to you there, and some great insights. And as Sydney was saying there in the chat, who works with the Alzheimer's Association, she just said they're so great to hear how other countries and its citizens handle this terrible disease. So thank you so much, Mandy, and thank you, Sydney.
Thank you, Sydney, too, as well. Thank you.
So now we're on to Tina. Thank you so much, Tina. I'll hand over to you there, and look forward to sharing your experience with us.
Thank you so much, Phil, and thank you, Mandy and Jan and Randy, you know, so much for sharing your very powerful stories. You know, talking about building your team, one of the things that I think of that's so important is the team helps us to preserve our mind, our body, and our spirit. And when I think about the team and the things that are so important, there are three elements: having the discussion, making decisions, and then offering directives to others who can provide support. The interdisciplinary team is essential when supporting someone living with Alzheimer's disease and dementia, and to be quite honest, in any disease is very essential. The person that is living with the diagnosis, they should be at the center of every single decision that is made. Every single decision that is made, and should be involved in the process, depending on the severity of where they are in the disease process. The person, every single decision is centered around this individual. What they like, what they think, what they feel, what they want, how they want it. That should really drive all the decision making when you start to think about the team and those folks who support the person living with Alzheimer's disease or dementia. Now, I have what I call Tina's 4 A's for building a successful team. Number 1, acceptance. This is for the person and their family. Accept that, oh my gosh, this is happening and it's happening to us. That is such a huge barrier, because often people live in denial for so long and will not seek out support. So the first thing people want to do is accept that this is happening. Number 2, take action. I've got to now do something about the fact that this is happening, and it's happening to us and in our home. Number 3, acknowledge what your strengths and your weaknesses are. Acknowledge what you can do and what you cannot do. Acknowledge that you might not be able to provide care in the home. Acknowledge that you might not be the best caregiver. And then number 4, allow people to help. That's a big one for a lot of folks to deal with, allowing people to help. Now, caregiving can be very draining and can be very isolating. So here for the caregivers and persons impacted by this disease, a few tips that are very important. Knowing what your role is on the team. What is it that you're going to be doing on the team? Know what your expertise is, and then know what is the expectation of the other folks that are on the team as well. Because you can bring together a lot of folks with a lot of skill and a lot of talent, but if not everyone knows very clearly what their defined role is, it can become very, very chaotic. So knowing your role and knowing what your expertise is, I think is essential for when you're planning an effective team. Now, I've got a couple of categories that I like to put these supporters in. They're essential folks that need to be on our team, and then you have to have a team of folks that are supportive. Here's a list of those folks that I say are essential. We've got to have these folks on our team. You need your healthcare provider on your team, your doctor, your nurse practitioner. The nurse needs to be on the team. And maybe a healthcare navigator, someone that can help you navigate all the moving parts related to your care. It could be a counselor, it could be a coach, it could be a care consultant, but you might need a navigator on your team. Your pharmacist is a great underutilized resource to have on your team because they can do a lot of things with medication reconciliation and give a lot of coaching at no cost working with your pharmacist. And then having your dentist on board, because the dentist can take a look at oral health, which is an indicator of lots of things related to cognition. So getting your dentist on board can be very important. Those are what I call the essentials. Then you need a supportive team helping you. So the first supportive person you need is what I call a distractor. The distractor, someone that you can hang out with, they'll come over, they do all kinds of things with you except talk about the disease. Because when you're living with a devastating disease, you really don't want to talk about it all day and all night. So you need somebody on your team that is a distractor. And then you need someone that's a good listener. They can listen empathetically, because there are going to be times when you just need to get it out. So you need a good listener on your team. And then you need a cheerleader. You know, a cheerleader, the one that says, go girl, you can do it. Everyone needs a cheerleader on their team. Now, I keep this little mannequin here. She's my cheerleader. That's what I have to use now since we work in virtually. So if I don't have anybody to say, go girl, I look back at that mannequin. I say, go, you can do it. So everyone needs a cheerleader. And then you need a realist, someone who keeps it real all the time. But then we also need an optimist on our team. And here's one that's super important. You need a fibber. That person that'll say, girl, you look good today, when you know that's the day you think you look an absolute wreck. They're the person who comes in and makes you feel like no matter what's going on, you can do it. So you need all these different folks coming together to build a very strong and effective team. Now, family and friends will often say, what can I do to help? And people don't know always what to offer to them. So I say, build out a list of things that people can do before you need them to do it. And so I ask you to consider putting them into categories. Here are things my neighbors can do. Well, folks at my church can do this. Folks in my women's club can do this. You can even build out a calendar. On Tuesdays, I go to the gym. I need somebody to help me with that. On Wednesdays, I'd like somebody to come over and help me cook. So build out a calendar of activities so that folks can come in and offer you some support. This is really their way of showing you that they love you and that they care about you. Think about your support folks, your extended support folks in this way. Who are the folks I can call when I just need a break? What's my list of folks I can call when I need to vent? The venting are those what I call our go-to people. We all have to have a go-to person in our life. The go-to person is someone you can call any day, time, or night and say anything. They don't judge you. They still respect you, and they keep going. Then folks, who are those folks who can complete a task, who can run to the market, who can pick up the laundry for me? Is there someone who could do the grass? So start to separate out those things that you need, when you need them, and how you need them. As you start to think about your team, who can walk the dog, who can go to the pharmacy for me. Really start to think about what your needs are, particularly because we're dealing with a disease that gets worse the longer you have it. So maybe you don't need that today, but at some point, you're going to need some additional support. Building out a list and building out a calendar can be very, very helpful, because you want to do everything you can to preserve yourself as a caregiver and to do everything you can to be as stress-free as possible. Taking some time and being thoughtful about who I want on my team And what I want them to do can be very, very helpful. You might have a brother who's great with financing. Great. Let's get that person handling that. You might have somebody else on your team who's great with cooking. Great. Let's get them on board with that. So play to the strengths of all the folks that you know that want to help. Here's a recap. The help provided by others can minimize stress and the feelings of being overwhelmed and isolated. Developing your own network of support can lead to a more productive, active, engaged life for both the care provider and the person who is living with the disease. Getting people to help you with certain tasks and works throughout the day is a great way to allow them to show you that they care about you, and it can help mitigate emergency situations. This plan will provide you and people who are assisting you with confidence and support for journey for another day. The most important element when you're thinking about building out your plan is to give people the gift of the conversation. Talk to people, let them know what your plans are, what you want, when you want it, how you want it, and then go forth, because it's all about the individual impacted by the disease and those who are supporting the individual who is impacted by the disease. So that's my tips for you who are planning out a plan for yourself or for someone else. And particularly if you're not married and if you don't have children, you really need a plan. Alzheimer's disease really is very widespread. It does not segregate who it will attack. So you really want to start planning in case you bump into cognitive issues as you get older. All right, I'll turn it back over to Phil.
That was so great, Tina. Thank you so much. I'm working on it already. So yeah, so much great stuff in there. And also as well from Mandy and from Randy and Jan, I really found it very, very informative and inspirational. Absolutely fantastic, guys. Thank you so much for coming on and sharing your wisdom and your experience there. That is really, really helpful and inspiring. So now I'm going to hand back over to Taryn for the Q&A section. We have about 15 minutes left for the panel, and the Q&A can be between the speakers as well as with the people on the in the audience. So over to you there, Taryn.
Thank you so much, Phil, and thank you to our wonderful panelists. I was definitely moved and inspired by each one of your talks. There's really some great information from Tina and Mandy, and really just moving and empowering story from Jan and Randy. So thank you guys so much. If anyone that's currently with us on the Zoom has a question, please feel free to use the raise hand feature. You're welcome to direct a question to one panelist or just generally to everybody. While we're waiting to see if anybody has a question, I have a question. So I would love to know, especially from Jan and Randy, but Mandy and Tina might have some suggestions too. If you guys kind of discovered or were pointed to a support or a service that was needed, but that kind of surprised you, like you didn't know you needed it, but it ended up being really helpful. Did you guys run into anything like that?
I want to say the early stage advisory committee or early stage advisory group, because they put together people that were in the same at the beginning stages. You're in shock, you just found out, your diagnosis, and you were with other people who were in the same position. So you got to talk through it, made some great friendships and that sort of thing. So that was something I didn't realize that was even available. And then it was even at the national level. Jan was on a national early stage advisory group where they got together with people and they basically traveled around and spoke to people. And basically, I think their goal was to basically show people that there is life after a diagnosis. So.
Awesome, thank you. Tina, do you have any suggestions for, I know that, Randy and Jan and Mandy also mentioned, having your primary care physician or your GP, a neurologist, Tina, you mentioned dentist. Are there any, pharmacists too? I'm wondering if, things like maybe, counseling, therapy, or any other kinds of services that might be available to people that they might need, but they don't know that they need it. Tina, have you come across any clients or people that that have really benefited from a service that they didn't know was available to them? Oh, you're muted. I'm sorry. I may have done that.
Working for the Alzheimer's Association, I will say to you, often our services are a surprise to most people. They have no idea what it is that we do. Many people have heard of us. They know about the walk, but they don't know about the core services that we offer. So I think that, and we are really aggressively working on this, if providers knew what those services were so that they could immediately plug those folks into those resources, they wouldn't have to do what both Randy and Jan had to do, bump into it haphazardly. It should be a resource provided to them. All providers, primary care providers, need to know what to do if somebody has a diagnosis of mild cognitive impairment, Alzheimer's disease, or dementia, and then plug them into the available resources really that come out of the Alzheimer's Association. So that's a big, it's a big aha. And I think a lot of it is because there are not standardized protocols for dementia yet. There are standardized protocols for cancer. If you get cancer, they go, we do this, 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 this. So we're working on protocols for dementia so that if you have a diagnosis, they do this and you will get plugged in immediately to resources that you need. So that's my 2 cents about that.
You know what, Taryn, I was going to suggest that, one of the things that I didn't get a chance to mention was the fact that I think socialization is so key. And especially for me, I made a point to stay engaged with my college sorority sisters, with my high school bunch. I picked up a love that I had started when I was 6, and that's playing golf. And I've made a new set of friends, and I engage socially with them on a regular basis. I cannot have any kind of isolation. And I think isolation is it's a killer. It's a killer in many ways. And, the pandemic showed a lot of that this last year. So that was something that I didn't realize, but I tell you, I'm fully engaged in all that right now.
That is so awesome. I'm so glad you've gotten so much out of that. And hopefully other people will heed your advice. And Mandy has a question.
Yes,
I just wanted to say.
Just wanted to say, in one of the health service areas in Northern Trust in Northern Ireland, anybody who is given a diagnosis of dementia will be allocated a memory link worker who works in HNI. So that means every single person in the Northern Trust area in Northern Ireland has a person to go to. And that person will give them supports and will talk through all of what you said there, Taryn, what's available in the community. What have you been interested in the past? As you say, Jan, maybe could reignite that interest. And they're almost like walking encyclopedias, social prescribing, supporting the person, but nobody gets through the loop, which is fantastic because every single person with a diagnosis has somebody to turn to. Not all the trusts in Northern Ireland have followed suit yet, but certainly works very well in the Northern Trust. And people would say it's fantastic because when you do get a diagnosis, as we know, it is very frightening. Don't know how to navigate the system, don't know where to turn, but to know you have somebody there and you can ring them at any time and they'll make contact with you every 3 months and you can ring in between if you want anything else and that person will support. And that's made a vast difference. It really has. So it's an area of good practice.
That's huge, Mandy. And we certainly don't have anything like that in the States. So you said Northern Ireland. So what's happening in the other parts of Ireland?
Very honestly, it's so different. Even in Northern Ireland, Tina, the different trust areas, it's so different. You know, it's completely different because it's completely different funding, it's completely different processes. You know, so we're not really familiar as much because we're not operational in the south of Ireland. We're not really sure, and that's being honest. But I know within Northern Ireland, even every trust area, it's not uniform. And that's in a very small country, really, or a very small part of the island, Northern Ireland. So, yeah, but that one area is an area of good practice, and let's hope it will disseminate out because it has made such a difference. I've been in meetings, I manage staff all over and on all the trust areas, and people have stood up to say if we have that support, that will make all the difference in the world, you know. So we'll see. We're hoping. It's always money. It's down to money, and COVID's not helping. So we'll see.
Can I make a comment? It's more like a step back. A lot of people say, well, my loved one has memory issues or cognitive issues, and they automatically assume it's dementia and they run off to a neurologist. I think it's key to make sure that you go run a battery of tests for all. There's so many physical ailments that can mimic dementia. And the good news is those physical ailments, most of them, there are cures and treatments for those. So that also should motivate you to get somebody to get tested because you start out with those tests. Because we had a person in our support group. She said, well, my husband's he just had dementia for the last 10 years. And it's like, well, has he been diagnosed? She goes, no, is that important? And I said, yeah, it's pretty important because the type of dementia, whatever. Well, it turns out he had hydrocephalus, like a buildup of spinal fluid on the base of his brain. And that's a treatable issue, but I think he had it so long that he didn't, a lot of times people will regain their memory after they get that treated. His didn't do that so much, but I really have a feeling it was because they waited so long and they didn't get it treated. So I think that's huge. That's one thing that when I saw a list of all the things that can mimic dementia, they're all physical ailments. It was amazing that you got to make sure you do your homework and get those all checked off before you run to the neurologist.
Absolutely right, Randy, because what happens in that particular memory link service that I've referred to, whenever somebody is going for an assessment, so somebody has memory problems, they've been to their GP and they're going for an assessment, so the list will come in to my staff and they will get a bit of pre-assessment support, describe what's going to happen, how long it's going to happen, where it's going to take place. So then anybody who's diagnosed with dementia thereafter, that list will come back, and that list is usually about a third of the people coming back. So you're quite right. The other 2/3, I've got something else, that have resulted in a bit of memory loss or confusion or whatever the case may be. So absolutely.
Well, that's shocking to hear for on my end. So yeah, thank you so much for bringing that up, Randy. Does anyone else have? Hold on. Sydney is asking, how would you say the American and Northern Ireland experience with dementia compare and contrast? I know, Mandy, you already said that even in Northern Ireland, it's so different. Do you? I don't know. Do you want to try to take a stab at that?
It's very difficult because I don't know how the American end of it works, and Northern Ireland is, yes, there's no question about that. There's some areas in Northern Ireland, there are dementia navigators throughout all the trusts in Northern Ireland, and they are a point of contact. So anybody can have a point of contact, maybe not a named worker, but they can have a point of contact. But I don't know. I'm learning about America. This is fantastic for me to learn tonight. So I'm not sure how the process works in the States. So I'm sorry, I can't really compare and contrast.
Well,
Yeah, no
I'll tell you
problem.
one thing. We don't have this navigator immediately plugged into families. I think there are some programs that do that. So there's some states that do that, but they're what we call one-offs. So the UK is pacing ahead of the United States as it relates to some of the services and programs that we're offering on the ground to support people with dementia. So there's certainly some opportunities for growth. I think the United States they're doing an exceptional job with taking a look at research and those things. But in terms of how do you help me live my best life, I wouldn't say we're number one.
Do you think that's because a lot of the mental health isn't covered by by Medicare and some of their, is it a financial issue in many cases? Because a lot of the services, if you had cancer, they would be covered, but a lot of the mental health issues like Alzheimer's are not covered, from what I understand, under Medicare.
That is correct. Medicare does not pay for this Alzheimer's care because it's considered custodial. It's not something they could treat. So Medicare wants to pay for things it can treat and or fix. So it doesn't pay for a lot of the care from that perspective. I just think some of it may be different philosophies, and it has to do with some of the, you know, medications and how we get those medications approved. The UK they're just doing a better job. They're a little bit more riskier, and they try, you know, and they're okay, and which is not bad or wrong. So I think we're getting there in the States, but we've got a little bit of ways to go.
Yeah, as of we as well. We have to remember, in the UK and Northern Ireland, it's a free healthcare service. So people can pay to go privately or get private healthcare insurance, but there is a free health service there. So that makes a difference also. And dementia has been very much at the forefront of going forward because it is costing the government so much to support people who are living with dementia. And in fact, before COVID, you know, it costed more than cancer services. So you find when that happens and you're in a health service that's being paid for by government, then the onus will come onto that service to try and reduce costs in some way. And that would be through timely diagnosis, through people having support, early intervention, really. So. But COVID again has rocked the world of us all, including our dementia services too. So.
Well, does anyone else have any questions that are with us on the Zoom, or panelists? Do you have any questions for each other, or any last parting words or advice that you'd like to give?
One thing, I think when Tina was talking, I can't remember which section but it just jogged my memory of something that somebody brought to our attention was. And I can't remember, it was a family member, it was actual healthcare institution that when they brought their loved one to a home, they had a booklet and it basically reviewed their life, had pictures and gave like a history of what their loved one liked, what they disliked, what they had done in their life, so that when the caregiver came into the room, they could look at that book and say, "Hey, Joe, I heard you were a firefighter. What did you, you know," and could kind of rekindle those memories, not only give better care, but help the person kind of remember some things. And that was just it seemed like such a simple idea, but I had never heard of it before. So it was kind of a unique thing.
It is, and that's actually worked very well within our services too. And I'll give you an example of a person was living by themselves. They were diagnosed with dementia. They had completed the booklet with one of our volunteers. So everything was there, and their likes and their dislikes and their routine and everything. Went into hospital, very fortunate the ambulance driver lifted the booklet, because when the lady went into hospital, she wouldn't eat. But when the staff eventually looked at the booklet, they realized she didn't like those particular foods. So that made all the difference. So just simple things and small things just make such a difference.
You know, it's really important because if you think about it, these are strangers. They don't know us. So they're guessing, and just a small tool like that. And if it comes from you, the better. You know, if you don't like to get waking up early in the morning with the shades up, people need to know that. So I think if my advice to everyone is to gift people with a conversation of what you want, how you want it, and when you want it, just in case you develop Alzheimer's or something else.
I think that's called the Conversation Project, isn't it? There's an actual thing out there that lays out a plan to have a conversation with somebody. It's mostly on a lot of the what you want in your last days, but it's the same thing. It's tell people what you want, you know, so they know and they're not guessing.
Yeah, absolutely. Well, in fact, in Northern Ireland now we are looking at a strategy for advanced care planning, and it's exactly that, and encouraging people 18 and over really to think about what they want for their future. So we're setting the focus groups for that right now, but you know, I'm in the middle of training staff on that because it is very important, and it doesn't leave your family or friends second guessing. You know exactly what you want, and you can change that at any time as you go along. And we're trying to centralize that, so it's almost like in silos. So somebody has this information here or here. So the process and trying to centralize that so that we really can respect people's wishes and wants.
And some families will say, I don't know what to ask because this is so brand new. And that's where organizations like the Alzheimer's Association can be so helpful. You can talk to somebody who can help guide the path for you. And you can find us at alz.org. That's www.alz.org. And there's somebody who can help guide you through the process.
Well, I think that's a great note to finish on. Thank you so much, Tina, Mandy, Randy, and Jan. We really, really appreciate having you guys. Thank you, Phil, for moderating. We wish you guys all the best and a happy weekend.
All right.
Thank you.
Thank
Thank
you.
you.
Very much.
Bye-bye,
Thank you.
guys. Thank you all so much.
Bye.
Bye-bye.
Thank you all so much. Thank you so much, Taryn and Melissa,
Thank you.
for putting it all together. Thank you so much,
Thank you,
guys.
guys. Bye-bye.
Bye-bye.